Hi, my name is Rose, and I'm going to be talking about the thorax. The thorax is the upper part of the body that is separated from the abdominal cavity by the diaphragm. It consists of the sternum, the ribs, the thoracic inlet and outlet, the lungs, esophagus, trachea, heart, and many other things that we're going to get into later on. You have your lungs that are enclosed in a pleural sac. They exchange gas between air and blood. There's two pleural cavities, and this is where the membranes secrete a small amount of lubricant between the surfaces while breathing. You have the mediastinum, which is the midline region of the thorax. First, we have our 12 pair of ribs. From here to down here at the bottom, the space in between is your intercostal space. We have our sternum, which consists of the manubrium, which is your superior portion. The body is the midline portion, and the xiphoid process is your inferior border. You have your thoracic inlet and outlet. The inlet allows for passage of nerves, vessels, and viscera from the neck into the thoracic cavity. The outlet is the inferior aperture. Pleural cavities have two layers. If you can see here, the parietal pleura is the outer layer, and this moves with respiration. Our visceral pleura is going to be the inner layer, and it covers the outer surface of the lungs. We have the trachea and esophagus over here. The trachea is going to lie anterior to the esophagus. The trachea is the orange one. It's the transmission of air into the lungs. Your esophagus is the transmission of food into the stomach. The mediastinum is located between the two pleural cavities. And here we have our thymus gland. That's your primary lymphatic organ, and it's a triangular shape. We have the heart in there, and that is protected by the sternum, ribs, and vertebrae. Down here we have our diaphragm, a large dome-shaped muscle, and it moves with inspiration. Back, we've got your scapula. All right, and now let's talk about a pleural effusion. That's this blue in here. It's basically just a fluid that accumulates into the pleural cavity. It can impair the breathing by limiting your expansion of your lungs. And the way that you determine it is either going to be through a CT scan, an ultrasound, or an X-ray. With an ultrasound, you place the probe against the skin, reflects high energy sound waves off the structure in the chest, and then an image is created. And once you identify that it is a pleural effusion, the doctor may have the sonographer guide him or her with the probe so that he can see, and then he inserts a needle in between, a needle and a catheter in between the ribs, and this is where they're going to drain the fluid. So that's pretty much it for the thoracic cavity. There's a lot going on in it, and I hope you enjoyed it.